Well, Tennessee has seen a more than 200% increase in overdose deaths involving stimulants. That's from 2018 to 2022, and it's according to some new data from the state's Department of Health. Now, since stimulants themselves don't respond to the overdose reversing drug naloxone, some advocates are pushing for techniques new to Tennessee to really help people achieve recovery. State Capitol reporter Tori Gessner explains.
Behind every statistic is a silenced heartbeat. Tennessee's overdose deaths are no exception.
It's tragic. These are people.
According to data released this year from Tennessee's Department of Health, more than 3,800 people died of an overdose in the state in 2022. Almost 55% of the time, stimulants like cocaine and methamphetamine were detected, a sharp increase from 2018 when stimulants were detected in less than 37% of overdose deaths.
Tennessee has long been known as one of the hotspots in the United States for methamphetamine use and methamphetamine overdose deaths, and that has not gone away.
Advocates say oftentimes now, stimulants like meth aren't the only drug involved.
One of the trends we're seeing with stimulant use is that people are sharing kind of myth, if you will, on the streets, that it kind of counteracts the effects of the opioid. And so it's a safer pill to take. That's something that has really concerned us.
Advocates are now searching for solutions to the rise in stimulant-involved overdoses, especially since stimulants don't respond to overdose reversing drugs or medications meant to help with recovery.
The options are not as rich for folks with stimulant use disorder. That is why it's so important to look at the tools that are being used in other states' toolboxes and see what we can bring here to Tennessee.
One tool, called contingency management, could help, according to advocates. The program rewards people, financially or otherwise, for not using drugs.
We're seeing data that shows people who engage in programs like contingency management tend to stay in treatment longer. They do better at engaging with their other treatment providers, and they are able to see less use of the substance.
Reporting in Nashville, I'm Tori Gessner.
Well, the Tennessee Association of Alcohol, Drug, and Other Addiction Services working to train providers on contingency management and says some nonprofits have gotten private grants to test out the program. The Tennessee Department of Mental Health and Substance Abuse Services identifying contingency management in its needs assessment this year.